really don't have a good understanding of a single cause of major depression. We do know there are a number of variables that may play a role. Personally, I believe that depression is a heterogeneous disorder. There may be different factors for different individuals. Some individuals may have a stressful life event, for example, and they may go into a bad depression. They may have a sibling who has that same stressful life event, but they don't go into a depression. We're learning a little bit about the genetics of depression, that someone's genetic makeup may actually predict how they respond to stressful events, and that may help us predict what to expect in the future. But the bottom line is we know that for some individuals, the stressful events may play a role. Now, chronic stress or acute stress, either or both, can potentially play a role in not only having someone go through their first depression, but if someone is vulnerable to experience a worsening of their depression. Other potential causes are, as I mentioned, there may be genetics. This is a very hot area in medicine right now to look at whether or not we can predict which individuals may suffer from, or maybe at greater risk for suffering from depression and other mood disorders like bipolar disorder. And then finally, there is what I call the stress diathesis model. This is where we kind of combine the environmental factors that may cause stress on us, and it can have effects literally in the brain, as well as on other organs in the body. We know that, for example, if someone goes through an acute stressful reaction, or maybe even a chronic stress, the body can release cortisol. Cortisol is known as the stress hormone. What happens if cortisol gets released, cortisol can have negative impact in the brain. It can cause brain cells to actually diminish. And actually, we can see what we call atrophy or degeneration of certain areas of the brain when cortisol levels increase. And that's an example of what happens in some individuals. And there is some data to suggest that if we don't intervene, that those changes that occur in the brain may be potentially irreversible. Now, we also know that if someone in this model, if you start to see these changes occur in the brain, we know that treatments, including antidepressants, psychotherapeutic interventions, even electroconvulsive therapy, can turn on something called brain-derived neurotrophic factor, something I call brain fertilizer. It turns the gene on back in the brain that allows those cells to replenish, and that is one of the reasons that I think we often may see people get better with treatment. But that stress diathesis model ties the importance of the environmental factors, not only in causing, but potentially even allowing someone to get better over time. Now, there's a basic theory of depression that has existed for probably decades. And there was a serendipitous finding back in the 1950s or 1960s. And that was when individuals who had tuberculosis were being treated with medicines to treat their illness. Their moods got better. Those medicines turned out to have antidepressant effects. So we worked backwards and asked ourselves, how did those medicines work? Well, it was that those medicines, some of those medicines actually raised certain neurotransmitters in the brain, namely norepinephrine, serotonin, and dopamine. And those theories are still one of the strongest theories we have about what the etiology of depression may be, that there may be a deficiency in serotonin, norepinephrine, and or dopamine. And so what we try to do with treatments, pharmacological treatments, for example, is try to regulate those neurotransmitters back to a normal state. And getting back to the stress diathesis model, we know that cortisol can diminish serotonin, norepinephrine, and dopamine. And so we're starting to pull the picture together more and more so that we can find better treatments and broad spectrum treatments, not just medications, but other interventions that will allow the individuals to get back to their normal life. Depression often doesn't exist in a vacuum. In fact, it's more the rule than the exception that depression often exists with other medical illnesses. It is very common, for example, to see very high rates of depression in individuals with things like heart disease, after someone suffers a heart attack, arthritis, diabetes, even neurological disorders like Parkinson's disease, very high rates of depression. And it's probably not just because someone is medically sick and they get situationally depressed because of it. There is most likely a strong correlation, even from a pathophysiology or a physiological standpoint, of why certain illnesses may link with each other. And depression, for example, and heart disease, and depression, and even certain forms of cancer may exist commonly together. And one of the important areas that we're learning more about is the immune system. We're learning more and more about how the immune system affects other organ systems, including the brain. And there are many theories evolving in terms of how inflammation may actually be a potential cause for depression in some individuals.